Hi guys. Right, today I'm coming because I want to talk about the blood tests that diagnose rheumatoid arthritis. I thought I'd start with snippets of information about RA, so it's easier to take in for everybody. So we've got the rheumatoid factor blood test. I've written a few notes just to make sure that I don't forget everything and I get the right way of saying things, because there's some long words. So we've got the rheumatoid factor test. Now this is the most traditional test. It's that's the long term test that's been used for rheumatoid arthritis. It's less accurate a test. It can be present in a number of diseases, so it might be another disease other than RA, rheumatoid arthritis. The rheumatoid factor can be present in quite a few autoimmune diseases. It can also be present without any sign of disease. In a certain amount of people will have the positive rheumatoid factor but no actual clinical signs of rheumatoid disease. People can also have RA without the rheumatoid factor showing up. In fact, the rheumatoid factor doesn't always show up in blood tests. The normal range for rheumatoid factor is 0 to 20 units per milliliter. Now the other test is a newer test. It's called Anti-CCP, which stands for anti-cyclic citrullinated peptide antibodies. This is a newer test with better accuracy. Its normal range again is 0 to 20 units per milliliter. This test is more specific to rheumatoid arthritis, so if you have anti-CCP positive, you're more likely to have RA than one of the other autoimmune diseases. And there's different tests for each autoimmune disease that are much more specific to each of those diseases. Whereas anti-CCP is the one for RA. It's got a supposedly 97% specificity to rheumatoid arthritis. The higher the level, the more likely the diagnosis, and it tends to point to a more progressive systemic form of RA, i.e. I am a high anti-CCP positive and I'm diagnosed as having the most severe form of RA, and it affects my organs, my eyes, it basically affects my whole system, my whole body. Anti-CCP is an autoantibody produced by the immune system that attacks the body. There is believed to be a connection between anti-CCP and genetic markers, which I believe my RA comes from hereditary, on a hereditary basis, because my father has it and my nan on my maternal side had it as well. And it's also thought to be influenced by smoking, which increases the risk of lung complications, which I smoked for 25 years. And I have the lung complications with rheumatoid arthritis called RA lung or RA-ILD, rheumatoid associated interstitial lung disease. Anti-CCP can show in the blood before disease activity begins, quite early actually. I say if I'd been tested sort of 20 years ago, it might well have been there, because, you know, although I think I had symptoms a lot longer than what I've actually been diagnosed. I think I only went and got diagnosed when the symptoms became so severe that I couldn't carry on living as that. About 20% of RA patients are seronegative, meaning these blood tests have come back negative despite having obvious clinical signs of rheumatoid disease. Excuse my breathing at the moment, I'm really not great today, and a lot of shakiness because of a lot of breathing medications and that.
Fragrances into those. Okay, so here we go. We're going to put some titanium dioxide in the jug. Quite a lot, because this is a nice pastel pink. We're also going to put some...
About 20% of RA patients are seronegative, meaning these blood tests have come back negative despite having obvious clinical signs of rheumatoid disease. In my case, my original rheumatoid factor test came back negative, and then my disease progressed rapidly. My rheumatology consultant nurse sent me for Anti-CCP and others like the ANA, which is for lupus, to check exactly what was going on with me. My Anti-CCP came back high positive. Many seronegative people will become positive at some point in the course of their disease. Other tests to note are that all RA patients will have many regular blood works drawn, like full blood count, white blood cells, the platelets. They do all, especially if you're on rheumatoid related drugs, then you will have regular blood tests, and that should show up any signs of increased disease activity or other problems. There is the ESR, Erythrocyte Sedimentation rate. Now this shows inflammation in the body. It's a general marker of inflammation, so it can be from any source. It doesn't have to necessarily be rheumatoid related inflammation. You could have an infection. There are just many things that can influence this, but when it's elevated, it does show that there's some sign of inflammation going on in the body. Then you've got the Serum active protein, or the CRP, which indicates inflammation if present. This is quite a specific test of quite a severe amount of inflammation. Normally it's not present in your blood, and if it is present above 1 unit per milliliter, then you are showing signs of quite severe clinical inflammation. When I've been in hospital with my lungs going downhill, I've had it up to 136 before, which was quite extreme. The doctors were quite worried about that. It is quite, for me, it's a very good sign of when I'm going downhill. My CRP will start rising. It can be affected by many things also. It doesn't necessarily have to be rheumatoid related. It can be infection related, and other diseases can cause it to go up as well. But that is the basis of the difference between the rheumatoid factor blood test and the anti-cyclic citrullinated peptide antibody blood test. Both are used to diagnose rheumatoid arthritis. It is possible to be diagnosed with rheumatoid arthritis without either being positive. If they are positive, it is more likely to be the more severe type of rheumatoid arthritis. So, especially with the anti-CCP, it's known that tends to be in the cases where the rheumatoid arthritis has affected the entire body and systemically organs and other parts of the body like the eyes, and mine has. If you have any questions about the testing or finding out if you've got rheumatoid arthritis, please put some questions down in the comments below, and I will try and make sure I get to you and answer your questions as soon as possible. Much love to you all. Breathe easy, folks. See you later. I should probably add here that I'm not a doctor. I've just done a lot of research and I'm an expert by experience. So if I can help, I will. I'll try to answer all your questions, and I'll try to guide you in the right direction if I don't know the answer. Like I say, I'm not proclaiming anything. I'm just me, Mama Cass with RA. I just want to say today as well, I'd like to send my love to the dear darling, my dear friend June Gaul, who's currently in hospital with her. She's got interstitial lung disease, or COPD actually, and lupus, very similar to my condition, and we've become quite close recently. Much love to you, June. Please do what the doctors say. Rest up. Please get better. I'm here, I'm praying for you, thinking of you. Much love, darling. Breathe easy.